Hi, welcome. This is Pat, and I promised you a little sample resume. So I'm going to give you a little bit of a sample. Maybe you've never really seen a resume or prepared a resume. I don't know where you're at, but we're going to go over a very basic resume today. So this is your header space. If I click on that, it opens my header. You're not going to put anything in your header. Now, if you did put your name and address up there, that would be fine. And your contact information, you could do that in the header, especially if you want to get more real estate at the bottom. That would be fine. But you're not going to write sample resume. I just want to make sure I'm clear on that. Your name goes at the top, and then your email, you can put your address there too, the phone number that a recruiter's going to reach you on. That's what you want to put in there. LinkedIn is social media for professionals. So it's not like TikTok or Facebook or anything like that. I would highly recommend that you look up LinkedIn and begin preparing your profile on there. They do scan LinkedIn to see if you have a profile. So it's important to have one on there. Remember, it is professional and you always use professional language and never commit any security breaches. So you never post any patient specific data or informations on there or anywhere, to be quite frank. Um, your objective is the first part of your resume, and you want to state, what do you want? What are you trying to achieve here? And so this is an example. Do not write this word for word and give it back to me or Kim. You want to use your own words, think about it, and find a way to say what it is you want to say that you're looking for. So this is an example: compassionate and detail oriented RN with a strong foundation, or you could say graduate RN, strong foundation in patient care and clinical skills, seeking a nursing position where I can leverage my CNA experience and contribute to a patient-centered healthcare team. You can say that. You can, if you really want to be highly specific, and I want a surgical circulating nurse role, then you say exactly what you're looking for. And if you're applying for a circulating nurse position, then this is very appropriate to state exactly what you want to achieve. Your education, you're all in an associate's degree program right now. So you would put your nursing degree in there, the university or the college that you're going to when you graduated or when you plan to graduate, what's your expected graduation. You can, if you have graduated from other schools previous to this one, some of you have previous degrees, you can list them here as well. Even if they're not specific to nursing, it shows the diversity of your educational background. Work experience, so that's a header there. This one is for certified nursing assistant, and then you put the place where you worked and the dates that you worked there. And then you list some of the things that you did, some of the skills. You don't want to get crazy with this, but you want to list some important skills that you did that um, you can speak to, that apply to your new role as a registered nurse, things that are going to help you along in your new role. Assisted patients with activities of daily living, including bathing, dressing, and feeding, monitored vital signs, reported changes to RNs, and ensured patient comfort, collaborated with interdisciplinary teams to provide holistic care, um, provided excellent customer service. Clinical rotation. So in your AD program, your clinical rotations actually can go on your resume. You don't have to get highly detailed. You can say various hospitals, the years of your clinical, and just sum up some of the experiences you've had. Here's one example of a summary: worked in medical, surgical, pediatric, and geriatric units, administered medication, performed wound care, and assisted in procedures, developed strong communication skills with patients, families, and healthcare professionals. If you had an opportunity to participate in any programs at facilities that you've worked at, particularly as a CNA. For example, let's just throw out there, you're working in a long-term care facility as a CNA, and the unit has put together a falls reduction program, and you participated in that as a CNA, and you reduced falls by 20%. You can put that on here. That's a number that you can put on here. Skills, patient care, proficient in ADLs, vital sign monitoring, patient hygiene, clinical competence, medication administration, team collaboration, electronic health records. If you have a specific one that you are very proficient in using, like Epic, you can certainly list that in there. If you're a super user already and been identified, and you show everybody or the hospital or the place that you work has signed you up as a super user who helps other people train, you can list that on there. Any skills that you developed in other non-healthcare related professions, customer service, things like that, you can certainly working in a team add on here. Certifications, all of your certifications and licensures have to be verifiable. So you can't say you're a certified CNA if you're not certified. You have to actually list your certification number, its expiration date, and they're going to look it up. Everything you put on your resume, they're going to look up. They're going to look you up too. They'll look on your social media and see what type of a person you are outside of healthcare. So you want to make sure that everything you put on here is honest and true. So you list the different certifications that you have, the dates that you have them, what's the certifying body. If you're a member of professional groups like the American Nurses Association or the National Association for Certified Nursing Assistants, again, they're going to check it out. They're going to look that up. So make sure that you verify everything that you're saying on your resume. Remember to customize your resume by tailoring it to specific job you're applying for. Highlight your unique skills and experiences. And best of luck in this job search. We're here for you to help you get these cover letters and resumes in order. I will work next on what does a cover letter look like and get that one out to you guys as well. All right, I hope this is helpful. Have a great day.